of these groups specifically mention the lack of a provider recommendation. Even those groups that don't mention that as a barrier, it still is a commonly found issue. In the research with this unscreened audience, what they found were only about 4 in 10 of these individuals had ever talked with their healthcare provider about colorectal cancer screening. When that happened, the clinicians traditionally did initiate it, that is, patients are not going to bring this up. And it often came in the course of a checkup as opposed to just during other routine follow-up visits. And that's very important because, again, as was mentioned in the preceding section, a lot of these patients are doctor averse and they're not coming in regularly. So it's important to take advantage of every opportunity you have with at-risk patients to discuss colorectal cancer screening. Even among these 4 in 10 who did hear something from their clinician, what they heard was they were due to be screening and that the screening should be done. But they did not hear why. They had no idea why, and consequently did not necessarily appreciate it as being important for them. And they almost never heard anything about testing options. It's great. A large body of research has now demonstrated the importance of making patients aware of options because, again, there are some patients who simply don't have access to colonoscopy, and there are others who have access but no interest, and they're simply not going to get that test done. So these patients indicated that in many instances, if their healthcare provider had given them more information about why it was important and more details about the fact that there are options, there's a greater likelihood that they would have followed through with that recommendation. So it's important when we talk to people about colorectal cancer that we appeal to the head, that is, give them rational reasons to follow through, but also appeal to their heart if we really want to boost screening. So how do we do this? Number one, we have to really promote this as an important issue. We can't wait for people to ask us. They're not going to ask us about it. We can't just tell people you need to have this done. We need to make it clear that this is important for them as an individual. We also need to discuss options with each and every patient because there are any number of patients that you will say, it's time to get screened for colorectal cancer, call this number and schedule your colonoscopy. And if that's the only message you give, they're going to say, okay, and then they'll come back 3 or 6 months later and nothing will have been done. They're oftentimes not going to tell the healthcare provider that they're not going to do the test, but their behavior shows you that that's not something they're going to do. Other important elements of the message include the preventive nature of colorectal cancer screening. The vast majority of these individuals had no idea that there are precursor lesions called polyps that you can find, remove, and prevent cancer from occurring. So helping patients understand we're not just looking for cancer, we're actually looking for something that we can remove and prevent cancer altogether. The importance of at-home testing is continually reinforced because many patients are uncomfortable with colonoscopy just because of the foreign concept. They're having to go somewhere else. They're usually going to see a doctor that they've never met before. They're going to be in an environment they've not been in before. So the idea of doing something at home is just frankly much more comfortable for them. So again, really focusing on the preventive nature of screening and educating patients about polyps. The other thing is to make it clear that even if the opportunity to prevent cancer by finding polyps, if that opportunity is missed, if we find cancer at the time of screening, there's a greater likelihood that cancer is going to be in the localized stage, and 90% of folks diagnosed at that stage are going to be alive 5 years later. So the survival climbs dramatically with early stage. So really hammering away the message about polyps and prevention, but also letting them know it makes a big difference finding cancer early versus late, especially with colorectal cancer. As I've already mentioned, the importance of at-home testing options is really much more important than we previously recognized for this group of unscreened patients. So knowing that there are options other than colonoscopy is imperative. So one of the things that we at the American Cancer Society and National Colorectal Cancer Roundtable are working very hard on is trying to help healthcare professionals understand better what some of these barriers are and how their communication and their approach to patients can make a huge difference in helping change that patient's mindset. So you need to change their understanding and their mindset in order to open them up to the idea of getting screened for colorectal cancer. There are a lot of different resources, some of which I've mentioned and June has mentioned, and then other resources that you can find at the website for the American Cancer Society or at the National Colorectal Cancer Roundtable website. And again, please consider tuning in for the July 16 webinar. If you have questions or want more information, June has thoughtfully provided her email address for you here. So thanks again for tuning in to this presentation, and look forward to you going back to your practice and making some changes to help us get to 80% in every community in California and across the nation.